Okay, this next lesson is on page 33. It's lesson 14. How much did healers and hospitals help the sick during the period 1500 to 1700? So we're thinking about how did hospitals change in the Renaissance period, and what about the healing? So if you think back to the lesson in which you did a graph looking at hospitals, hospitality, the church, and women, that's kind of what you're directly comparing to now in this lesson. So if you were to have a question about change or continuity in hospitals or caring for the sick or treatments, this is maybe something that you'd be looking to revise. So what we're doing today is we're looking to evaluate the extent of progress made by doctors and healers and hospitals during the period 1500 to 1700. The first thing that you will be doing on your sheet, so this area here is more so a summary, so you actually have to complete this after completing the table on the next page, so skip this out for now, we're going to come back to it. You're then going to go to this starter image over here. I'm just going to put it up in, well, if I can find it. Yep, over here to make it a little bit bigger for you. Now, you would have recognized the image on the left. We looked at that in great detail in our hospital lessons. And you should be able to kind of come up with the ideas of, oh yeah, I remember it was church, there's two in a bed, people are old, not particularly sick, people are being given food, not a lot of medication going around, there seems to be people sewing, there seems to be a lot of praying. We know what the treatments are like. Now, what you need to do is, first of all, label any changes that you can see or anything that you can notice from the image on the right. So straight away, one that you might be able to notice is the lack of religious imagery, suggesting that maybe there's a location change. So if on your booklets you just kind of annotate label around the picture, we might not be able to see religious imagery. So a physician, so a doctor visiting the sick in a hospital. Okay, so this is a hospital. Now it is Germany, but it's a hospital. Okay, so when we're thinking about Europe, this is now a hospital. Now, another thing we can see here is a doctor is visiting the sick. It's not what we saw before of hospitality and taking care of the old. We see someone who's able to give medical treatment and diagnose a patient, and someone who is sick. So we've already noticed three things: lack of religious imagery, a doctor's there, and there are sick people. You should be able to notice the key of they're now in separate beds. Okay, so maybe with the idea of transference and the idea of just better understanding, they seem to have different beds. Okay, and we don't see people kind of being given food so much, but because there's a doctor, we can assume that maybe they're going to be given a diagnosis or medication. So if you can just kind of label and annotate the differences, feel free to do that for the image on the left too, refresh your memory a little bit. Now, after you've done that, we are essentially just working from this graph today, and we're looking at 4 different aspects in groups of individuals when it comes to healing and treatments. And all you have to do is read through it, read through the information and putting the missing words. And then, after you've done that, you need to assess how much has changed. So, do you think things have changed a lot? Do you think they've changed a little? Now, it's out of 10, so obviously 10 would be things have changed enormously, and 1 would be there wasn't really a lot of change. Now, the boxes are small, but you then have to write down why you put a number. So if you put 10, then you're probably going to say there was significant change. If you put 5, you might say there was some change. If you put 3, you might say limited. 0, 1, you might say no. So we'll do one together. We'll stick with hospitals because we're on that theme anyway. So we're looking at hospitals, continuity. So continuity, if you don't know it, means stays the same. So what things have stayed the same? Most hospitals did not allow those with infectious disease to stay so they could be treated. So no infectious diseases are still not allowed to be in hospitals. Many hospitals continue to provide food, warmth, and prayer for the poor and the vulnerable. So these things over here, they have stayed the same. For the poor and the vulnerable, like the monks and nuns had done during the, obviously that's going to be Middle Ages. Okay, so far we know, okay, so some things have stayed the same. They do provide food, they do provide warmth, they do still believe in doing some prayer. Let's continue. Let's have a look at the change. So many hospitals that had been part of monasteries were closed when Henry VIII changed England to a Protestant country after the Protestant Reformation, after Martin Luther had challenged the, what church? It's going to be Catholic Church, but some were taken over by town councils. So some hospitals that used to be part of the church are now closed down. Now, if you feel like you didn't understand that sentence, just make a note of it next to it. Hospitals run by church closing down. Some. So St. Bartholomew's Hospital, founded in 1123, had grown by 1660 to hold up to 300 patients across 12 wards. So we see that hospitals are not just the kind of small sort of local churches now. We see that that's a lot of people that they're now taking in separate wards. St. Bart's was one hospital that began taking in the sick in order to treat their illnesses. Patients were looked after by a team of 3 doctors, 3 surgeons, and 15 nurses, and a large number of untrained nursing helpers. So what we should be able to see here is that while there were some things that stayed the same in hospitals, a lot of it has changed. And that's because you're finally able to get treatment in a hospital, and there are genuine, professionals who can help you. So for me, I might say, while, there was some little bit, so there were still some things that stayed the same. So I might say that's an 8, okay? And then I might argue, so there was significant change, is what I'm going to say. Then I'm going to write down why I think that. This is because people in society were now able to get treatment and medical advice. Hospitals now had trained professionals to diagnose and medicate, while infectious diseased people were not allowed. The majority of people could seek treatment. Okay, so something like that, just to justify my rating there. And that's what you have to do for each section. So you've got doctors, how things have changed. So remember thinking about their kind of learning, their understanding, their training. You might see some change there. You then have surgeons. So they're the people who do surgery, obviously. And then you've got the role of women. So in the Middle Ages, remember, they had a more sort of, they did a lot in the home. They used a lot of herbal remedies. Have those things changed? Now, when you are doing your kind of assessment of those things, make sure that you are really picking out specific details, because that's what's going to help you with your niche knowledge to make sure you have factual evidence in an assessment. Okay, and then you can do this sort of summary. So after completing the table on the next page, use phrases from the list below to sum up the extent of change that has occurred. So thinking about all your kind of assessments that you've made about doctors, hospitals, surgeons, women, overall, would you say that there was a lot of progress? Would you say that things have changed a lot, or would you say they've stayed the same? And there are just some statements to help you. So you could say, continuation of existing medical practice, little progress made, improved medical knowledge but limited or no impact on health or life expectancy, improvement paved the way for later progress, key medical principles established, increased access to treatment and care, developments improve medical procedures but do not provide consistent results, medicine is becoming more professional, direct impact on health and life expectancy. So those are just some phrases in which you can assess change. So you would write down here your genuine perception on whether you think things have changed. So to give you a sentence starter, you might write something like, I think that there was, and then you might say no, limited, some, fair, significant change in how people cared for the sick during a census period. This is because, and then think about those phrases. Think about whether you think things have changed a lot or whether they haven't, depending on whichever one you sort of write down. Once you finish that, you just have to fill in the summary box. So it's going to be very similar to what you've done over here. So you can just focus on, if you've kind of, you can, if you want, just extend this box into there and carry on writing. If not, then I want you to pick out three examples of a big change from here in bullet points to write down in your summary box. So I'll just write that in here. So 3 bullet points on changes in hospitals / healers. And that's that lesson done. Thank you.